Good morning. I'm Dr. Sharon Huner, and I am the course coordinator for NGC 502, Applied Informatics to Evaluate Healthcare Outcomes. This is the overview for week 3, and we will be focusing on the electronic health record and web-based consumer education. The lecture includes a review of chapters 15 and 17 and a brief review of the Alexander chapter on the electronic health record because it includes some very useful definitions, and I want to make sure that everyone's starting off in the same place. There's also a brief discussion about the informatics project part 1, and the rubric for that is included in the lecture because there has been some interest from students to anticipate what they need to be doing for that. The part 1 of the informatics project is not due until the end of week 6, which is about 4 weeks away, so you still have plenty of time on that. This is just to give you a sort of sense of what kinds of things you might be wanting to look for. There's also a very brief overview of informatics exercise number 2, but probably more importantly is there's a very extensive demonstration of IE number 2, which is a group assignment, which you're going to be needing to work on very soon. So I'm going to encourage you to jump ahead to the informatics exercise demonstration very early in this week so that you have the opportunity to collaborate with your group and assign tasks that are based on the group members' expertise. This is a very unusual exercise, I think, for people who are going to be starting out with your summary statistics of a particular population, either Medicaid, Medicare, or the commercially insured population. And then what you're going to go back is, first off, identify the population of people that match those characteristics from a demographic perspective. And then you're also going to generate a plausible claims history that matches the utilization from your summary statistics. This particular exercise is done by the group. That means that everyone in the group, as long as they have participated, will get the same grade, and only one student in the group actually turns in the assignment. The assignment is located, if we go to the group page here, and I go down to the group home page and scroll down, here's group assignments, and there's informatics exercise number 2, and that's what you're going to use at the end of week 3 when you actually are submitting the Excel spreadsheet with your population and their claims history. But you definitely, in this particular activity, you definitely want to start off very soon. It requires a lot of collaboration, and hopefully in week 2, your group had a chance to sort of come up with a plan for how they want it to collaborate. Now, there is, in addition to the lecture that I'm doing under the new content, there is also, going to module 1 here, and there's also an interview with Dr. Robin Laley. She is going to be describing her web-based education program for newly diagnosed patients with breast cancer. Now, there's also in the tasks for week 3, there's a large number of documents that are used for the informatics exercise, and we go through all of them in the demonstration. In the Digging Deeper section, there's 2 chapters that you may want to take a look at, and in the required reading for week number 4, there is the chapter on the human technology interface, and there also is within this, there is a paper, a manuscript, that I would like you to read, called a Usability Evaluation Guide for Nurses to Forecast Patient-Safe Technology Use. This is very important for the usability study in week 4, and you definitely want to read that. So now I'm going to talk about one other task that you have for week 3. So in week 4, we're going to be doing a usability study, and this is part of Mary Colson's capstone project, and because it is a research study, it has gone through IRB, and there is a consent form that you need to review, and you need to let us know whether or not you decide to actually complete this assignment. So the consent form is located over in the tabs on the left. You can see the actual consent form here, and you can go through and read that. Why am I being asked? What's going on? This is exactly what you would be providing for someone when you're doing your capstone research. And then also there is, we go back out to this, there is a consent for participation or the alternative assignment, and I'm just going to click on that. Well, what this is a test. It's set up as a test, and basically what you do is after you've reviewed the consent form, you're going to go into here. I'll select Begin, and there's one question. It says, I have reviewed the consent form for the study and agreed to participate. If you select No, then you will be provided with the alternative assignment on day 1 of week 4. So I'm going to say yes here, and you're going to save that and submit. Click OK to submit, and so now I've done that, and I can view the results of that if you want to. And it should tell me, I guess I can't review the results here. But anyways, I've agreed to consent to be part of the study. The only reason that we need to do this week is so that I can determine who needs to get the alternative assignment at the beginning of week 4. And just a little bit more information about this. The usability study will ask you to follow some steps that Mary Colson has developed for you to test the tool that she's developed. There'll be a demonstration about that. And then what you want to do is do the steps that she said and then complete a survey. When you complete the survey, then there is a code at the bottom, and you will submit the code to the assignment so that I can give you a grade for completing the exercise. The results of the survey are not accessible by me in any way at all, and I cannot evaluate the grade that you're going to get for that. I can't come up with a grade for that. So everyone who completes that and submits the number will get their 5 points for the assignment. If you don't have access to an iPhone, and you can't get access, and you can't meet with Mary Colson here on campus, or figure out some way to actually do the usability test yourself, then you will need to do the alternative assignment. Additionally, there may be people who do not want to participate in the usability study for whatever reason. There is no penalty to you. You will get a slightly revised version of the assignment for week 4 from last year, which is looking at consumer websites on a particular topic. And if you say no to the consent form, I will give you that assignment on day 1 of week 4. So it sounds more complicated than it is, but I think that the usability study will be a really interesting thing, and I'm hoping everyone will be able to participate. So that's it for week 3. There's a lot of group work for this week. You can certainly email me or email Dr. Casucci if you're in one of the first 3 groups to talk about questions, concerns, problems. If you're finding that there are people in your group who are not participating by Sunday, then that's what I would consider an urgent problem, and you should let me know, and I will try and track them down and let them know that they are in jeopardy of getting no points for the assignment because they haven't participated. I also want to encourage you to do your participation within UB Learns, first off because I can see who's participated and who hasn't there, and also because we are using here real data, and UB Learns is a secure environment, as opposed to if you take everything out and try and do that in Google Docs or some other place. So please try to work within the technology and collaboration tools that are in UB Learns for your groups. I will definitely go through any number of different tools that you've used to try and see what people have done and how they've contributed to this when we're actually coming up with the grade for the assignment. Thanks so much. Have a great week, and let me know if you have questions. Bye now.